Onychomycosis, fungal nail infection. It is primarily caused by dermatophytes and various recent fungi with tinea pedis infection in the skin that basically surrounds the nail. So many of our patients come to us at the rehab hub to see our podiatrist, and they have these unsightly yellow, crumbly nails. But what's important when we're treating these is that we get the right management plan in place. Many patients have bought over the counter solutions and just get nowhere with it. And hopefully, through this presentation, we give you some tips and why that is and what you actually do need to do about it. So we said there in the last slide that the cause is primarily the skin is infected. And you can see from these pictures here that kind of familiar discoloration of the nail plate. And there's various different types of infections that it can be, but effectively they all look fairly similar, like the pictures that you can see. Now, when we are trying to treat this, what we have to do is we have to treat the skin. Now, the skin is infected underneath the nail, and when we're putting on topical agents that you might get from anywhere, whether it's Lamisil or anything antifungal, the problem is, and the reason that it's not going to resolve the problem is because it's not reaching the problem, it's not getting to underneath the nail. So one of the things we do in here is that we will use our special tools and we will drill through the nail plate and inject the antifungal solution down into that so that the nail bed is basically submerged in the solution, and that's passed through the holes and then it basically laterally spreads underneath the nail as the patient's walking about. So we're effectively treating the skin underneath the nail plate itself. It is incredibly difficult to get to treat fungal infections. And as we said there, most of the topical agents that you've been buying are unable to penetrate the nail plate. Different factors that increase the risk of nail infections are things like if you've had damage to the nail or biting, diabetes, psoriasis, or weakened immune system, smoking, general poor health, but also sports and activities. So if you're a runner, we see loads of runners at the rehab hub, and many of them have had nails that have been rubbing, they're hitting off the top of their shoe, and this then gets this trauma towards the nail kind of thickens, and it also allows for this kind of brittleness of the nail and allows this portal of entry. And add that into that moist, warm environment of their sweaty shoes, and we have this perfect condition for fungus. So yes, kicking, poorly fit footwear, feet constantly getting worn in damp shoes, all contribute to the risk of nail infections. Additionally, things like maybe you've gone to a nail salon and they're not sterilising their equipment, so you can very easily pick things up. So always be very cautious of that. But those are the main ways that you can pick up nail infections. And it is estimated that at least 5 to 10% of adults and almost half of those aged 70 plus suffer from fungal nails. So in clinic here at the rehab hub, in both our clinics in the West End and in the South Side at Kinning Park, we use the lacuna method. And what we're doing with that is we've got a whole protocol that we put you through when you see us. And that includes overall looking at why you've got this nail infection in the first place. So we make sure and assess the skin, and we deal with the skin, but that's your whole foot, what's going on, and then obviously get a diagnosis, make sure it is a fungal nail infection, and from there we with that positive diagnosis, we would then start the lacuna method. And lacuna method isn't a short-term treatment. It does take about 18 months. That's roughly how long it takes for a toenail to grow back. So you have to persist. So you really, if you want to get rid of this, then you have to have the patience, and be seeing us usually on 6 to 8 weeks weekly basis, for treatment. And we give you all the kind of medication and things you need, when you're coming in seeing us. So that should do you. So you're basically just seeing us every 6 to 8 weeks. We give you everything you need, and full instructions what you need to do. But it's important to know that this is not a short-term fix. Things that we recommend, even if we don't see you, but things that we would recommend to you is to keep your feet dry and cool. Fungus loves warm, damp places, so make the environment impossible for the fungus. And don't share towels, socks, and shoes. Consider replacing your footwear. I know that might be quite costly, but if you have that infection, then you're going to have fungal spores. So thinking about public places, wearing flip-flops, make sure that you're not exposing yourself to more, picking up more infections by having your feet in things like communal showers. Socks, so just make sure you are changing your socks every day. We would also recommend washing your socks at 60 degrees, especially if you have a fungal nail infection, just to ensure you're killing off the spores. And we would usually recommend socks that are bamboo based, so blended socks, rather than cotton. So looking after yourself, making sure that if you have diabetes, that you're controlling it. Smoking does not help. So yes, I think for most things health-wise, smoking, if you can reduce or certainly quit would be amazing, but reducing that down will help you. Wearing breathable footwear, so where possible, and especially when you are going through the Lacuna method with us, not wearing any nail polish, because that will clog up the little holes that we've drilled. So it will be impossible for the medication to reach the skin underneath the nail if you clog the pathway down with nail polish. And we also recommend that you rotate your footwear, and wear properly fitted shoes with a wide toe box to prevent injury to the nail. So basically, what most people are doing is they wear shoes that are too narrow for them. So that's one thing. Or they've got a particular position of their toe. It's usually the big toe. It's usually the big toe or the fifth toe, the little toe, that initially gets infected with fungus, and there's usually a good reason for that. The reason being is the trauma to those. So if you are, for example, coming off your little toe, so if the way that you walk, this little toe, and sometimes the little toes tend to rotate round, so it's getting this kind of impact trauma all the time. So that would be one reason why that's more susceptible to it. And for the big toe, usually what's happening there is the big toe is hitting off the roof of your trainer or your shoe. And sometimes that can be your metatarsal head, so the big bone of your first so your first metatarsal phalangeal joint. So basically, if you imagine your big toe, the bone under your big toe is what we call plantar flex, so it's kind of pointing down too much. That means that your big toe is sticking up more than it's kind of meant to. And that then means that while it's in your shoe, you've got this kind of toe that kind of sticks up a little bit, so it means that it's just constantly going to be hitting off the roof of your shoe, and that is well known for this kind of micro trauma happening, and you get this thickening of the nail and then fungal infection on top of that as well. So certainly getting some podiatry help there, because there's things that we could do. Maybe we need to give you some rehab for your feet. Maybe you need an orthotic to actually reposition how your foot's sitting. Really depends. Everybody's different with that, but certainly what you try and do is reduce the amount of trauma happening to the nail. So those are kind of some good tips for you. If you are struggling with fungal nails, please do get in touch sooner rather than later. The key here is to try and catch this as early as possible. So even if you see your nail lifting, or it just looks a bit crumbly, if you've got a bit of athlete's foot, these are all early signs of that. So please don't ignore it. If it is too bad, or you've had it too long, don't think that there isn't things we can do, because there are things we can do. So for actually fairly recently, I had to take off somebody's big toe because it was so bad. It had been infected for over 10 years. And this particular patient, I was so embarrassed by it. Couldn't ever. It was a female, and she wanted to wear nice shoes, she wanted to wear sandals, and was just so embarrassed by this toenail. So what we chose to do for her was actually perform nail surgery because it was so bad. Took the nail off, and we allowed the nail to grow back. But while the nail was growing back, we treated the skin um, for fungus, which is the overall skin, and she's got a lovely, healthy, beautiful new nail now. So there are options if your nails are particularly bad. So if you need any help with fungal nails, please don't hesitate. The details are on the screen. The phone number is 0141 3630306, or you can pop onto our website, get a little bit of information. Initially, what you would book is just an initial podiatry consultation. So just book a new patient consultation, and we can then discuss your suitability for treatment from there. Hope this helps, and